Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today, we have a very special guest. We have the Chief Operating Officer of QBio, Clarissa Shen. Clarissa, how's it going?
It's great to be here, Jared. Thanks for having me.
I'm excited. I love, look at the artwork you have behind you. Like you live and breathe this. Like this is
Oh yeah, we
incredible.
are fully into quantified biology here. So art, data, it all comes together.
I love it. Well, let's first tell the audience a little bit about yourself for those that may not know you, and then we'll dig into QBio.
Sure. The short of it, my role here at QBio, I've been with the company for over 5.5 years now, has been growing the company from a commercial standpoint and helping scale the company. So everything outside product and engineering and kind of the R&D sciences, that's the kind of stuff I cover. So all the work we're doing around regulatory approvals. We have our first FDA submission that we put in, all the work around early partnerships, and then obviously the very important things around scaling a company. So I talk about this a lot. Building a product is just not just building the kind of company. It's about building the team, bringing the right people in, making sure that they have the right environments to ship and build exciting stuff.
I love it. And what made you want to join this team in the first place?
So when I left my last role, I was also chief operating officer at a fast growing startup. I could see where the future was going in terms of data and AI. And in my last role, it was an ed tech company, but it was all about helping large companies embrace big data, embrace AI, ML. And I could see where it was changing whole industries. And I was specifically very interested in healthcare, where I felt like compared to even some other industries, it was a little bit slower on the uptick, but you could see the huge impact it could have. And so I specifically sought out a company like QBio that was at the forefront of thinking about where data and big data was going, where AI and ML could take healthcare, and especially from a preventative standpoint. I think all of us have a bit of a story here, the folks who joined early, around where healthcare failed a little bit in catching things early. And so we have a bit of fire in our belly around how do we really change this and bend the curve so that it really is more about healthcare and not sick care. How can we catch things early? How do we think about prevention and proactive care? And that's why I'm here.
It's really interesting when you look at if we catch things early enough, just how much we can actually like either maintain or get rid of, right? When it comes to like
Yeah.
different types of cancers,
Oh, yeah.
because majority of the time when those things end up, taking someone's life, it's because they were caught too late, right?
Yeah.
Because there's only so much we can do when we catch these things too late. So
Yeah.
rather than have you, by the way, dig in to
Yeah.
QBio and the platform, I know you have a cool, like you can actually walk through some of it with us. So why don't you share your screen and we'll go through that. I'm excited about that.
Yeah. And then before I shared screen, maybe a little bit of how we think about this. So for background, one of the things that we focus on here is in order to catch things early, we think about building your clinical digital twin. And a clinical digital twin, for those maybe not familiar with that term, is really about how do you map everything that you can know about system biology from multi-omic standpoint, right? Everything from genomics, biochemistry, vitals, all the things that we can measure out there. And then proprietary to QBio, and by the way, the Q in QBio stands for quantified biology. So that gives you a bit of idea of what we've been building. We also believe that there's a missing piece to a lot of things that are being measured, which is what we call radiomics. So imaging derived, radiology derived biomarkers. And for us specifically, we focus on MR. It is considered the gold standard of imaging in terms of catching and finding things in the body. And so that's where we build in. So just as a preview of what you're about to see, I want to make sure you can understand it. It's our clinical digital twin platform. So this is what we call our whole body clinical digital twin platform. We call it Gemini, which, by the way, we named before all of the Google AI stuff came out. So I know now there might be a little bit of confusion around Gemini, but for us, our Gemini digital platform is really about your whole body digital twin. You can see here the kind of proprietary to us quantified anatomical measurements. So this actually fully quantified numbers, measurements so that we can track changes in your body based on MRI measurements that we've derived. If you want the traditional view, we can turn this all off, and you can see this is kind of more of the traditional view that you get from maybe MRI imaging, which is that black and white image that radiologists have to interpret, right? And literally what they're looking for is that hyper intense contrast for findings. For us, that means it becomes very subjective. And so we focused on quantification because if you really want to make this much more objective and longitudinally trackable, so you can actually look at changes over time, you need numbers and quantifications. And that's why we've built these models. If we turn on these models, you can see we have all the kind of organ segmentation, musculoskeletal quantifications, even visceral and subcutaneous fat volumes in here. And then what we also pull in across the board is anything else we can measure about you. And on the summary page, what we'll do is we'll pull out the most relevant biomarkers. That might be, you'll see 16 biomarkers that are out of clinical range that you might want to focus on. There may be things that have worsened over time that we want to flag, and things that might have improved over time. And so, and then 9 biomarkers that since the last time we've done any measurements have moved into clinical range. So they're grouped now as a summary for you to get a very quick snapshot of what's happening as in your body and kind of baseline measurements. We also have an AI generated risk summary now. This never gets released to a patient without a physician review. So it's actually surfaced for physicians, and in some ways to give physicians superpowers. If you're looking at hundreds and thousands of data points, right? That's a lot. So we want to actually give you a quick summary of the 3 to 5 things that you may want to discuss or focus on when you're looking at this dashboard with a patient. And if the physician wants to edit it, delete it, not publish it, it's fully within their control. We can also include things like known risk models. In this case, we have an ASCVD risk score. We've pulled in all the biomarkers related to the ASCVD risk score and given you the calculation. We will always link to the models and the known kind of publications around that. And this is, again, up to partners on whether they want to include these models into the dashboard. Beyond the risk summary page, so as a quick snapshot of what's happening and the most kind of salient things that you want to discuss with a person, including there will be imaging findings, right? So you can click in and look at some of the imaging findings. You'll see things like labeled, hey, there's a 5 millimeter cyst. It's been stable throughout. You can just monitor it, not worry about it. But if you want deep dive in, we also include beyond the summary level things system by system. So things like your nervous system, hormonal, circulatory, and you can do a full head to toe data physical. On the nervous system side, for example, we include all the quantifications around neurological measurements around your brain. So you can see things like hippocampal volume, right hemisphere, frontal lobe volume, all sorts of measurements that we can quantify around your neurological health. And this can be really important for things like neurodegenerative diseases that are coming. Other things, like around circulatory system, you'll see here you won't have just the quantifications we pull from imaging, like ejection fraction, aortic diameter, septal wall thickness. These are all measurements. There are also things that we'll pull in that are related around biochemistry, and vitals that we might have pulled in. So whether it's your blood pressure, whether it's your traditional LDL panels, platelet counts, including them all in here as a summary view. You get a full system level view of your cardiac health. Another interesting system, I think, for a lot of people is kind of musculoskeletal. Here you can see a lot of the things that we pull in, not just from vitals and from biochemistry, but also things around quantified measurements around your musculoskeletal system. So things like muscle volume, fat fraction in your muscle, lean fat fraction, lean muscle volume. All these numbers are pulled in. So I think this becomes really interesting for some of the folks out there who are really into health and fitness and doing some training and might want to see if there's things changing based on certain behavior changes that they're making. Another way to explore the digital twin is to click in. You can click in anywhere on your digital twin and find out, okay, what is this? This is your left anterior thigh muscle. If I were to click in on this, you can double click and find out it's part of the musculoskeletal system. We can go back into that view. But here, what we'll do is flag things like if you want to just look at the MR quantifications and measurements, we'll highlight that here. You can see all the quantifications around your left anterior thigh muscle highlighted. So that's one way of exploring. The other way of exploring, because now this is all structured, clean data that's been aggregated, is pretty much a mini search engine for your body. So you can start asking questions of your body. Like, I want to look at all my heart measurements, search heart, and it'll pull up any of the clinical biomarkers related to heart. Or if you want to be really specific, you can type in cardiac and it'll pull in cardiac function and measurements that way. Or you can actually start asking smart questions of your clinical digital twin. So what is my diabetic risk profile, right? I can ask that question. And we don't answer it right now. We want to be very careful around substituting physician diagnostics. But what we'll do is we'll pull in all the relevant biomarkers related to this question. So you can see here, we'll pull in, cholesterols, obviously, BMI, weight, any of these kind of numbers that we have around HbA1c. All these get pulled in so that either you or your physician can very quickly ask this question of your own twin and get an answer around kind of the data side of the answer. We are experimenting here. It's not in this dashboard view, but for physicians, starting to generate kind of language snippets based on our AI model to give them an actual answer. But obviously, again, similar to this kind of risk summary here, we're never releasing that to the patient just yet without a physician having reviewed it and determined the kind of right level of information to share.
And
so that's kind of a quick overview.
And those AI generated like snippets and that summary, that is all just meant to, like you said, it's not going to the patient. It's meant to give the clinician the information that they need.
Yes.
To okay, that's perfect.
Yeah. It's the way we think about it is, with all this data out there, how do you give physicians superpowers around ingesting, visualizing, pulling in information that is most salient for any person that they have this kind of digital twin and baseline for.
And at the top, you have all the different snapshots of when they came in.
Yeah, so this is an example of here where you see this little icon, the Q icon. It means that that's where we've collected data, or the snapshots of time where we've pulled in data for this particular patient profile.
I love the attention to detail, even just the Q instead of like a little instead of just a dot, right? Or these are when your visits were. That's super interesting. And how often do you think someone should actually go through? Like, is it every 6 months? Is that what you're doing here? Or is it 12 months?
I think we actually leave this in the decisions of a patient together with a physician. There are people who come in once a year as a kind of annual exam. But it's really dependent on your risk profile. In fact, one of the things we want to get to long-term with our model behind this is to tell you, when is the best time to come in based on your data. Because right now we leave that in there in the kind of physician guidance. Some people, based on their risk profile, come in once a year. If you're a healthy 20-year-old and everything looks good, I mean, you don't have to do something like this for another 2 years maybe. But then there are also people with known risk profiles. We have some examples of people who are doing this where they're coming in, every 6 months, depending on something that they might be tracking longitudinally and that they want to really see the rate of change in a shorter time period in order to decide what the next best action is. So it really depends, again, on your own personal baseline and your risk profile.
And in that particular risk profile, that'll be dependent on also like family history, right? Like exercise, diet, things like that.
Yeah, and there might be things around like, in this case, there's no genetic findings, right, in terms of things that we've tested. But there might be some genomic and family history profile for certain risks that you might want to come in and check on. And there may also be things that come up because, as you've been tracking things, they're starting to go out of range. And a really important thing in disease progression is obviously rates of change. And so part of it is looking at, are some of these biomarkers changing at a rate that is of a concern? And so those things might get flagged as well.
And are you doing like these biomarker are you conducting these, or do you have a third-party partner that you work with for that?
Yeah. So we don't think of any of the biochemistry, vitals, genomics, anything as proprietary to us. In those cases, they are sent out to, known and trusted FDA-approved kind of labs and panels and providers. In most cases, we actually allow the partners. So we've been integrating our Gemini digital twin platform now with certain hospital partners. In those cases, it's up to them to decide what kind of panels they want to include in there. And so we see our platform as really flexible in integrating any of that kind of data. based on what the partner wants to see. Or we also have some concierge physicians who are sending, patient panels to us. And in that case, we're really an outsourced lab, if you will, of aggregating all this data. So they can, in many ways, control what they want to pull in. The one area that is proprietary to us is the whole body MRI scan component, where we have a specific sequence that we run, and then we do all the data processing and obviously the quantification that you see here in kind of the radiomic data set.
So talk us through the process if someone wants to go ahead and do one of these scans with you. What does that look like? Maybe just kind of high level from start to finish. Thank you for sharing, by the way. It's so cool when we get to see, and not just, we got to hear from you. We also got to see that. So thank you for sharing.
Yeah. Hopefully, I don't know how people can see this on the podcast, but
they have to tune into the video. They have to press pause and go to the video.
Please check out the video. And so how do people get this right now? We do have a research center here at Redwood City where people have been coming to us if they really want to get their own clinical digital twin. In that case, they come in, it's about a 45 minute whole body scan. And then we collect all the, the blood samples, urine samples, do all the vitals on site, and then generate this dashboard for you. And that's where some of the concierge physicians we work with have been sending us their panels of patients as well. We also are now licensing our Gemini digital twin platform. So the software is a software as a service license that we provide to certain hospital partners. I can't share too much about some of the partners just yet. We're going to be announcing a couple of those hopefully very soon. But we've been integrating this now with some hospital partners where similarly they're running kind of longevity offerings, if you will, or precision medicine offerings, sort of high end of the market right now. They're serving an executive health audience. And similarly there, I think most cases they're coming through and getting, a panel of labs, doing some other vitals, and in all those cases doing a whole body scan as well. And we just take all that data, we've integrated with them and directly process all that. And at the end of it, they get a dashboard similar to this. In those cases, it's in some cases kind of white labeled. So we see it as powered by QBio. You get this precision medicine longevity kind of offering in some of these health partners.
I love it. I like the licensing approach too, right? Not to knock that when you see there's been companies out there that went we're going to do the facility build out, but this allows you what you want to do. You want to get this technology in the hands of the people that, need it so that patients can get what they need. So I love that approach.
Yeah. I think one of the things we take very seriously is everything that we're building, we're looking at population scale in the end. It's got to be about population health risk to have ultimate impact on the kind of proactive preventive health space. And so while yes, in the short term, we are serving the high end of the market, where none of us are here building this kind of, deep tech to just serve a very specific slice of the audience. I think it's great that there are obviously offerings out there serving that market. But everything we're building, we're looking at how do you scale those at population scale. And so from the software side, this is about how do we make this license and software available for anyone who wants to adopt it. And then on the hardware side, we're actually also building hardware and a scanner that can do a 10-minute whole body scan and can be also, actually put into many more environments than traditional imaging environments. So that's also something we're building on right now. It's called our Mark 1 scanner. And our scanner there is in manufacturing already, and we're aiming to get hopefully FDA approval for that sometime end of 25 or early 26. So that's another area that we're investing a lot to make this population scale. Because if you're reliant on existing technology, which is traditional MRI, it is going to be always somewhat limited and very expensive. And so that's kind of something we're solving for as well.
I love it. Clarissa, I want to thank you so much for joining me on the podcast here today. And for anyone that was listening, go back, watch the video. You'll be glad you did. Thank you so much.
Thank you.